Good day and welcome to Shape of the City. Osteoporosis is a major health concern for postmenopausal women. Currently, the University of Nebraska Medical Center is undergoing a study trying to determine better ways to prevent osteoporosis. Today we're here with Dr. Laura Billick that will tell us more about the study. How are you today, Doctor?
Great. Nice to be here.
Could you tell us more about this study by UNMC, which, if I am correct, is the Heartland Osteoporosis Prevention Study?
Yes. As you mentioned, we're looking at ways to prevent bone loss in early postmenopausal women, and we're comparing different interventions that we know have a positive effect on bone. So we're comparing the effect of just taking calcium and vitamin D supplements to the effect of taking these supplements plus exercise, or taking these supplements plus a medication which is known to prevent bone loss. And we're looking at how each of these interventions keeps our bones healthy.
Why is a study like this one so crucial?
Well, osteoporosis results in fractures later in life, but the problem starts earlier. And actually, 50% of women will have a major fracture at some point in their life. And for women who have hip fractures later in life, 20% will end up dying within a year. So the problem is, many people have fractures later in life and die from a fracture. We don't often think about that, but we have to treat the problem much earlier to prevent major fractures later in life.
How long has this study been going?
About 3.5 years. We have another 1.5 years left. We're recruiting women to enroll in the study for approximately 6 more months.
And what's the end objective once the term is done with the study?
Well, the women who enroll in this study participate in the interventions I mentioned for 1 year, and then we look at their bone health after 1 year in the study. Take all that data, analyze it, and see which of the interventions might be preferable over the other. Publish all this data, and based on that, see what the next study might be. We have some early results that suggest exercise may have a very specific effect on a certain type of bone, and it might be independent of bone density. So we're already looking at how we might explore that more fully.
One of the biggest things, especially nowadays, is confidentiality. What's going to happen with the information that they give to you?
Well, we treat all information confidentially, just as their doctor's office would.
What are the criteria that you're looking for to select participants?
Well, again, we're looking at women in the first few years of menopause, so it has to be within 6 years of a woman's last menstrual cycle. And they have to not be on any medications that affect bones, like estrogen or hormone replacement therapy or other medications, and generally healthy. So if they call us, they can find out more to see if they qualify, or if they go online, they can take a screening test and find out independently. Then if they qualify based on those characteristics, they come for a screening visit where they have a DEXA scan at no cost to see what their bone health looks like, or their bone density. To be enrolled in the study for the year-long portion, they have to have early bone loss or osteopenia, meaning kind of the precursor to osteoporosis.
What's the level of dedication that you're looking for in the participants? Like if somebody were to ask, what's the investment of time for the week, for example?
Well, it depends on which group they're randomized to. Everyone is given calcium and vitamin D at no cost to take every day, and boy, our women are very good at taking their supplements daily. If you're randomized to the medication group, you take a medication that prevents bone loss once a month. We send that to you, it arrives in your mail, it's at no cost. If you're in the exercise group, we have you pick your location to exercise at your convenience, a YMCA either located in Omaha or Lincoln, and we prescribe exercise 3 times a week. We understand there's life, there's no consequences if you don't make it to the exercise, but we have a prescribed exercise program for a year-long period of time.
What have you heard from the participants? What kind of feedback?
The knowledge about the disease process and how to manage it is very important. And also, there is no limitation on independent exercise during the study. We don't try to limit anybody's lifestyle while they're in the study. So I think most people appreciate that the study doesn't inhibit them from doing what they want to do, and that they are then contributing to a way to help solve this problem of how do we prevent fractures that could lead to death later in life.
Thank you very much. Exercise researcher for the Heartland Osteoporosis Prevention Study through the University of Nebraska Medical Center. Thank you for being with us and have a great day.
Thank you very much. I appreciate it.
Today we're here with Andrea Holka. Andrea is a participant of the Heartland Osteoporosis Prevention Study. How are you doing today, Andrea?
I'm great. Thanks, Roy.
Well, thank you for joining us today and letting us know more about this study. Could you tell us how and why you decided to join this study?
I can. So last February, I went to the doctor and I had a bone density test, and it showed that I had osteopenia. And then several weeks later, I randomly got a postcard in the mail regarding the Heartland Osteoporosis Prevention Study. And I was really intrigued because it was right up my alley. And so I did the pre-screening online, and it showed that I should qualify. And so I contacted them and set up an appointment, and they did the testing, and so here I am.
Could you tell us why you feel that this study, participating in this study, has been important to you?
It's been really important to me. I take 2 supplements, which is part of the trial, and then I also exercise 2 to 3 times a week. With this arm, I'm in the exercise arm of the study. And with the calcium and the vitamin D that I take, my bone density has improved, actually, a very small percentage, but that's cool. And then the vitamin D has been really important to me because previous to that, at least 2 years previous to that, my vitamin D was so low. And so with this study, and them working with me with my very low vitamin D, I've been able to actually sustain and maintain a very healthy level of vitamin D, and so I feel much better.
What are other benefits that you have received from participating in the study?
So as an exercise participant, obviously the exercise has been extremely beneficial, and then taking the vitamin D and the calcium is also really important for women for bone density. And you get education and resources when you sign up for the trial that help you understand why you're doing what you're doing.
Did you have any hesitations and any perceived benefits that you had in your mind when you were actually entering your information?
So when I got the postcard in the mail, it was a UNMC clinical trial, and of course UNMC is located in Omaha. So I did wonder, how that would look if I were a participant from Lincoln. And fortunately, they work with the YMCA down in Lincoln. They work with both the Northeast Y and the Cooper Y. So those are the 2 locations that if you're an exercise participant, you can go and exercise there. But even if you're in the other 2 arms of the trial, it really only involves 2 or 3 trips up to Omaha. And there is actually some compensation for that included in the trial. So it's really not, that really shouldn't be a barrier.
Perfect. Thank you very much for the information and sharing with us. And, congratulations on the results.
Thank you.
Thank you for joining us today.
It doesn't hurt to make a phone call to find out if you qualify and to find out more about the study. There's really no commitment to reaching out to find out more.